You're probably wondering why I'm starting here when I'm talking about homocysteine optimization. Well, homocysteine is implicated in early hair loss. So let's talk about that. And then we'll also talk about the issues with high homocysteine as well. So there's a lot of issues: cardiovascular, brain disease, sensory, reproductive, endocrine, skeletal system, and also the kidneys there. But let's just unpack how homocysteine can cause early hair loss. Many mechanisms of action here. So as you can see, alopecia, a common type of hair loss. So it's basically like an autoimmune disease there when it happens way too early. So you've got high homocysteine and you've got high CRP, which is inflammation there. So homocysteine right here, as you can see, it's driving poor blood flow to the hair follicle. It's causing a lot of inflammation and it's also causing hypertension. Now, hypertension is strongly associated with androgenic alopecia hair loss, and this is significant 2.2 increase. So when your homocysteine is up, you're going to have hypertension, and your doctor will probably put you on hypertension medications. Why don't they start here optimizing homocysteine? Because it's easier to prescribe drugs. They make a lot of money prescribing drugs. Now, right here, this is how you regrow your hair. So there's four phases. You've got four phases of regrowing your hair there, but you've got to increase blood flow. So when your homocysteine's up, you've got a bit of hypertension, you've got poor blood flow, poor endothelial function, nitric oxide production. And then your growth factors, they also go down. We've got to push growth factors up for hair growth. And methylation is also involved in creating DNA bases, folinic acid for hair growth. And you've got to also directly stimulate the growth of the hair follicle there. So if you've got inflammation that's undiagnosed, if you've got high homocysteine, you have inflammation, your hormones are all out of balance, you've got increased stress because you're tired and fatigued, oxidative stress, you've probably got poor nutrition, and some medications can also exacerbate it. And right here, inflammation, early stage alopecia, so inflammation is associated with it. Now, here's the big issue that a lot of people face. One of my clients that came to me, he said that his physician checked his inflammation. He said it was good. They sent him on his way. Is that good? We don't think so. Functional medicine likes to see it under one, but ideally 0.5. So you want to get it at least 0.5 and below. So it's like 3 times higher than what it should be. So you got inflammation slowly causing this hair loss, but also a lot of other diseases as well. So homocysteine, let's talk about it. So there's 22 genes indirectly and directly involved in optimal homocysteine. So there's a lot of things that are going on behind the scenes there. Now, over here, if you don't want to have heart disease, high homocysteine levels here causes plaque to build up in your arteries. Number one, plaque in your arteries. And number two, you've got lesions in your arteries, and the system will blame red meat. They'll blame cholesterol, and cholesterol is just trying to patch up the lesions from homocysteine. But inflammation is also exacerbating it as well. So that's how heart disease plays out. So as you can see there, stroke, heart disease, cardiovascular disease. But then it attacks your brain. So you've got things like epilepsy, dementia, Alzheimer's, Parkinson's, Huntington's disease, MS as well. And then your eyesight taps out, and your hearing, your hearing really starts to suffer. Your reproductive organs start to suffer. So your fertility goes down, your testosterone, sex hormone production goes down. Your endocrine system suffers, your skeletal system suffers, and your kidneys also suffer. And the paradox here with kidneys is they excrete a lot of homocysteine, about 7 millimoles every day. So if you've got kidney disease, it's going to climb up, and they haven't got a solution for that. So you really want to pay attention to it. Now, gut health. They've shown with meta-analysis when you have poor gut health, and they call it dysbiosis. So you could have a leaky gut, you could have dysbiosis, which means bad bacteria, not too many good bacteria there. So that can increase this meta-analysis there, fourfold increased risk of homocysteine, serum levels of homocysteine there. So we're talking about Alzheimer's. This is gut health, Parkinson's, Huntington's, stroke, goes on and on and on. And it's pushing up homocysteine. As you can see here, another research paper. When you've got poor gut health, homocysteine is in the up position. So let's really make this absolutely clear. When I went through and did my certificate in nutrition, I was blown away by how important the gut was. I knew it was important, but I didn't know how important. The functional doctors say this, please pay careful attention. So your symptoms, it could be brain fog, it could be joint pain, it could be bloating, constipation, stomach pain, are early signs of any autoimmune disease progressing, like Parkinson's disease here. So let me play this little video for you. This is from a clinician, Dr. Daddis, who's got a PhD, DHSC, DC, MS, MMSC, FACN, talking about the early signs of Parkinson's disease.
So if you look at the early signs and symptoms of Parkinson's disease, gastrointestinal constipation is right on top of the list. That may be the only presenting symptom, and if you see that with loss of smell, it may take several years before they actually start to get writing cramps and posture instability, and may take several years before they have rigidity. So be aware that some case of Parkinson's may be causing these chronic gut issues. And we know that Parkinson's also affects younger people. There's young onset Parkinson's between ages 20 and 40. That's about 10% of cases. And these patients also develop chronic constipation and vagal issues that are involved.
And then you're on your road to dementia and brain diseases, as we now understand. So the problem that I've learned is that when you go to your standard old doctor there, if you got all these symptoms and they say, oh, this is just normal, it's a normal part of aging. But as we've now learned, it's autoimmune disease progressing. And if you want to live with these diseases, that's okay. Don't pay attention to it. But if you want to fix this problem, I'm here to help you. So we want you healthy, and we don't want you progressing here, putting up and suffering with all of these symptoms: brain fog, joint pain, low sex hormone production, body fat going on, and you can't pack on the muscle. You've got sleep issues, insomnia, you've got gut pain, you've got chest pain, you've got all of these issues. They are symptoms there. Your body is screaming at you saying, fix it, fix it, fix it, fix it. And this is what I'm going to show you how to diagnose and do today. So let's now talk about where homocysteine levels should be on a blood lab. So I'm going to give you multiple ways to check this out. Now, the problem that we've got is that if your physician even checks it, they'll say 14.5 and below, you're good. They'll send you on your way, and that's not good. We want to get it between 5 and 7. That is optimal. That's where we need to get it. That is perfect. So when I got mine checked, like you can see here, a couple of clients, 15.1, 17. This is pretty typical. We've done lots of these tests now, and around 90% of them aren't optimal. So many people are not optimal with homocysteine. Now, when I did check mine for the very first time in 2021, it was 10.7. And I knew right there and then that it was too high. And it took me 9 months to get it back to optimal. So what we have to appreciate there is it can take some time, anywhere from 2 to 9 months, sometimes 12. Very rarely we see it take 12 months, but 2 to 9 months to get homocysteine back to optimal levels. Because you could have poor gut health, and that can take 2 to 6 to 9 months to correct as well. So there's a lot of moving parts that we have to correct for. Now, as you can see here from the PubMed research, we have the homocysteine optimal levels is between 0.5 and 5 and 7 there. So let's have a look at my database for homocysteine based on that study there. So these are all the genes that are involved. So what we're doing, we do genome testing, and we're optimizing for all of these genes there. So there's quite a lot there. So this is why it can take some time. Now, my genes in particular, I don't have very good homocysteine genes. I've got some of the worst that I've ever tested, and I've tested hundreds and hundreds of these genes, and I have definitely some of the worst I've ever seen. That's probably not you. Now let's talk about how we can have a look at your homocysteine levels. So this is what's called a blood methylation panel. This is not a genetic panel, but this is a blood panel of all of the markers for homocysteine. So right down here, you can see that homocysteine, she's high, and thankfully they're marking it as high. So it's at 12. So they know that that's high. We want to get it here, right? In the safe zone. And then, of course, down here, we've got these other ones that are super important. I'll show you why they're important on the next screen. But you can see glutathione, the master antioxidant, she's low, which isn't good. Then we've got taurine in the butter zone there, which is fine. But then we've got cysteine really high, and we've got cystathione there really high as well. And we need to optimize that. So This might look a bit complicated, but it's not. Just let me walk you through it. So this is what methylation is all about. So if any of these genes along this pathway, along here, along here, over here, if they start to slow down, homocysteine will start to go up, right? So if you're not getting enough B6, serine, or you don't have optimal iron, heme iron, it will bottleneck there and cystathione and cysteine will build up. So let's just go down that pathway. So this is joining this pathway here. So this is pathway one. This is pathway two, the glutathione pathway. So you can see here that cystathione there, we need B6, serine, and also iron. Then it goes through this CTH1 to cysteine. Now, this is where it gets pretty funky because if you've got too much cysteine, and as you can see here, this person has way too much cysteine, it's high in the red there. Guess what's happening? Back over here. It's turning into reactive nitrogen species, and that's pushing up your blood pressure right there. And this can cause lipid peroxidization and DNA damage. So when we understand all of that, we can see where the bottlenecks are. And when we do a methylation blood lab, we can say, well, here's all the issues and here's all the genes that are pertain to that. And then we can optimize it because we can see here that we need zinc, we need methylfolate over here. This gene over here, we need magnesium and potassium. So you can see that once we understand where the bottlenecks are in your metabolism, we can start to optimize these 22 genes for homocysteine and get your homocysteine back to optimal levels. However, it can take some time because you've got epigenetic gene modifications going on, and anywhere from 2 to 9 months is what it takes to get your homocysteine back to optimal levels. So you've got to stay the course. Now, another big issue, as you can see here, that this whole pathway, homocysteine, something that's very toxic, comes down here and turns into the master antioxidant glutathione. So, as you can see with this panel here, they don't have great glutathione. And that's because they've got bottlenecks in their metabolism there. And here's all the symptoms of low glutathione. So you can see how it's just all compounding. If your homocysteine's up, it's a clear indication that you've got issues in your metabolism. And it's generally due to you not having enough key nutrients or you've got some genes that just aren't optimized yet. And that can take time, 2 to 9 months to optimize there. But when you're talking about neurodegeneration in brain, Alzheimer's, Parkinson's, Huntington's, then you've got ALS, migraines, multiple sclerosis, autism. I mean, autism, ADHD, ADD, bipolar depression, cardiovascular disease, erectile dysfunction. They go hand in hand. And then you've got pancreas and thyroid issues, immune. So all of these, cancer, lupus, viral infections, asthma, acne, Lyme, allergies, gingivitis, arthritis, inflammatory skin conditions, accelerated aging, more asthma, chronic fatigue, chronic obstructive pulmonary disease, gout, hepatitis, cystic fibrosis, infertility, eyes, and gastric ulcers. So you can see how important this whole metabolism here is. So all these vitamins and minerals are going to help get you back to optimal. But if you've got poor genes for methylation, you've got poor genes for glutathione, you've got poor genes for homocysteine, we have to figure that out to get you back to optimal. So that is pretty key to understand there. Now, what you want to think about when it comes to homocysteine, it's like one of the most important markers that really indicates to your whole metabolism that you've got adequate vitamins and minerals. Now, as I mentioned there, the medical system will say around about here is okay, but that can be causing this lesions in your arteries and also plaque to build up in your arteries. And they'll blame cholesterol and they'll blame red meat. So your lifetime load of homocysteine adds up to hair loss. It adds up to a lot of deleterious health outcomes, as you can see right here. So this is the big issue that we're facing there. So plaque in the arteries, hair loss, all of those things start to show up. And they say this is a normal part of aging. So let's talk about the solution. So right here, basically the first thing that you want to do is check your nutrient status, and I'll show you exactly how to do that. And I would consider getting your blood labs done so your thyroid panels can be out. Now, the issue with current physicians, they'll only check 1 or 2 thyroid labs, and you really need 6 to 9 labs checked. Because if you're only getting 1 or 2, you've only got like 11% of the information to optimize your thyroid hormone. So we really need at least 6, ideally 9 labs, 9 labs for thyroid there. And then, of course, metabolic syndrome, which a lot of people have. And this is going to show up on your blood labs. And unfortunately, the standard labs just aren't optimal. You can still have metabolic syndrome when your labs aren't optimal. And we've got a PDF that you can download. It should be linked below to show you what those labs are and how to get them back to optimal range. And then, of course, you can also do that blood methylation panel that I mentioned earlier. You can also do your genetics there and have a look at all the genes that's involved in methylation, glutathione, homocysteine, Alzheimer's, all of those things. You can do your labs there. If you want any information on that, drop a comment below. I'm more than happy to do that. Now, unfortunately, if you've got kidney disease, you are excreting every single day about 6 millimoles of homocysteine. So they've shown that homocysteine lowering therapy is very effective for people that are healthy, that don't have metabolic disease. But if you've got metabolic disease, it's pretty difficult. So you don't want to put this off. Now, I just want to play one video to really emphasize that you must take this seriously. One of the last times that I spoke to Dr. Ken Berry, he said this to me and it really absolutely shook me to the core. Listen.
Absolutely. It's often too late by the time you've become financially comfortable.
Yeah.
Very often you've done so much damage to every tiny artery in your body
Yeah.
that you're now stuck with permanent erectile dysfunction or permanent forgetfulness or permanent insomnia, permanent shortness of breath, chest pain, right? Gut issues. You've done so much damage. Some of it can't be taken back. And that's why I'm so active on social media, constantly reaching out and trying to help people, because once it's too late, you might regain a little bit of that function, but it's never going to be like it once was, and it's never going to be like it could have been. And that's very sad if you think about it, that somebody's basically handicapped for the rest of their life, physically or mentally or emotionally, because of bad dietary decisions that they made for the first few decades of their life that they didn't realize were bad decisions because they had never been trained properly.
Exactly.
Yeah, so that's exactly what I'm trying to do is speak about this important topic and give you tools to be able to solve this problem. So if you're a younger person, it should optimize pretty quickly. Homocysteine levels, they're like 2 months or so. So again, what you need to do is check your blood labs. I've got a PDF below that you can have a look at and see which labs to get checked, or the ones that we recommend, and also what are optimal ranges, like homocysteine between 5 and 7, C-reactive protein 0.5 and below, at least under 1, not below 3, because when you've got say 1.5 or 1.7, that's low grade inflammation and you're on your road to any autoimmune disease there. Now, the next thing you can do is check your nutrient status. So the system kind of recommends that we eat all of these foods here, don't they? This is what they recommend. Just have a look at that. This is what they're recommending that we eat. Now, their overall nutrient density, of course, is low. I wonder why they're telling us to choose these foods. And then they're telling us to avoid these foods right here, which are their overall density. And this is the USDA's website. They're very high. And as you can see and appreciate, when you have a look at all of these, we need adequate vitamins and minerals to keep all these pathways working. So how do you solve this problem? Well, the easy solution is to use an app, and the one that we prefer because it's very accurate is what's called Chronometer. So you can download this app and it's going to give you your overall targets, your vitamin status, your minerals, your electrolytes, your immune support, your antioxidants, your bone health, and your metabolism support, homocysteine, methylation, all of those important markers of metabolism. And then it also gives you which vitamins and minerals you're potentially lacking. So it takes, it probably You'll learn this app in about 20, 30 minutes, and then you start logging your food and you'll start going, well, shit, I'm missing this one. I'm missing this one. And then you can have a look at the foods that are high in it, and then you can add those to your nutrition plan. And of course, I don't know why they're not recommending these foods, because they're very high in nutrients, but instead they're recommending these foods. And this is what Dr. Ken said to me the very first time I spoke to him.
The untrue story that eating a slave diet is the healthiest diet for a human being. Eating a plant-based diet, that's exactly the diet that the Roman emperors fed their subjects to keep them from revolting. That they had a full belly, they didn't starve to death, but they had no motivation, they had no mental inquisitiveness or ingenuity, and so they were easy to keep down.
Yeah.
Yeah. So you got a full belly, you're packing on the fat, but you're very tired. Your homocysteines are, and you feel like garbage, and you're moving towards dysbiosis, poor gut health, and all of those pathologies and metabolic syndrome. You're packing on the weight, you're losing your hair, you feel like an old, lazy loser, and it's not you. As Dr. Ken said, we just haven't been trained properly. We're listening to the wrong people. Now, here's all the vitamins and minerals that's required for methylation. That one pathway that I mentioned. So check that out, 26 nutrients. And I learned this from Chris Masterjohn, who has a PhD in nutrition science. So we really want to pay attention to vitamin status. It's one of the easiest things that you can do to optimize your homocysteine. Now, here are some signs, according to Chris, of undermethylation. So you can pause that and read over that right there, undermethylation. And then you've also got signs of overmethylation. So a lot of people, they're up, they're down, they're up, they're down, they're all over the place. And it's also dependent on your genetics. So as I've now learned, we've got to get in this normalcy, in this butter zone there. And when you do that, and again, it can take 2 to 9 months to get back to that place. This is why people, they just don't put in enough time. They don't track, they don't measure, and they go, oh, it's just too hard. Well, of course it's too hard, because you're tired and you're stressed. It always is harder before it becomes easier. And that's what you really have to take home. If you're taking your health seriously, you have to track, you have to measure your blood labs, you have to find out where they're wrong. Then you have to work towards getting an optimal range. You have to track your nutrition. And then you can do the advanced stuff like genome testing, gut health testing, food sensitivities, IgG, IgA. And that's when you're going to really start to thrive. So that's exactly what we really need to take into consideration there. Now, blood labs, I've got a PDF link below, because a lot of people are suffering with metabolic syndrome and they've got no clue. And one easy thing that you can do to start supporting homocysteine, this was done in a clinical trial, and it dropped homocysteine by 26%. Now, homocysteine and methylation go hand in hand. And creatine, so don't take creatine unless you get your health check there, because creatine supplementation mightn't be for you. But 40% of methylation is to just make creatine. So what they did in this clinical trial over 8 weeks is they got them to take creatine at a certain dose and also do resistance training, which is super important for DNA methylation. And it dropped from 12.66 on average to 9.33, and that's a 26% drop with just changing that one thing. Now, make sure you get a health check before you consider supplementing creatine. So that's how we're going to start thinking through it. So just summarizing what we've learned today. So nutrient status is the first thing that you need to look at. And again, it can take 2 to 9 months to get this right. The next step that I would do is look at your blood labs, find out where they are. Don't have your head buried in the sand. Then after that, have a look at your gut health. Then you also might want to look at your genetics there. So these are all advanced strategies you can use down the road. So that's exactly how we're going to get our homocysteine back to health. Now, if you're younger, it's probably only going to take you a couple of months. And if you really start looking at your nutrient status and then start looking at all the other videos I've done on gut health, that's going to really help you as well. They should be linked below. So that's all I've got for today. So if you've got any questions, drop in the comments below, because we don't want to be up here and causing all those diseases, including heart disease there, atherosclerosis, stroke. We want to be in the green zone over here with homocysteine. We want to keep it there for lifetime. Nutrient status, gut health, all of those things I've mentioned is a long step in the right direction.